Sometimes things are very difficult and we're looking for a fast answer, a solution. I call that the quick fix. And the reality is that when we're talking about people with developmental disabilities and mental health issues, there is no quick fix. When we do the quick fix, what happens is we see somebody for a half an hour or an hour. They say, tell us what your problems are. You give the list of the problems. They look at those problems and they map that out to a list of problems, or what we call disorders, and say, yeah, sounds like depression. This is what we do for depression. Here's a medication, or you can have this therapy, or you can talk to someone. Go ahead and do it and let us know how it goes. But it's much more complicated than that when it comes to people with developmental disabilities. And there is no magic bullet in terms of how to resolve the problems. Part of what we need to spend our time on is trying to understand that rich context of what is going on with the problem. And there's an order to which we do that. Okay? We can't even deal with treating the mental health or psychiatric issue until we rule out or address some other major things that could be contributing to the problem. The first thing that we need to look at are medical issues, because very often people with disabilities have problems that nobody has treated. And if you're in pain, or if you're having a problem seeing or walking straight, or you're irritated because something's not working right in your stomach, all of that can make you very frustrated and not respond to things the way people would like. So you need to make sure that all the medical things are taken care of. That includes having regular assessments of how your vision and your hearing are working, and also things like how your teeth are working, that there's no pain or problems there, that everything in your body is doing what it's supposed to do. Sometimes people have a hard time because they don't have the support that they need. The solution in that situation is to try to beef up or make more supports for that individual so it matches what their needs are. On the flip side, some people have a hard time because they have too many supports. People expect they can't do enough, and they actually can do more than that if they were given the freedom and the ability to do it. So if we understood and we matched a person's current needs to the supports and expectations that people have around them, that can make the situation a lot better. After we've dealt with the medical issues and we've dealt with the support issues and the expectations that other people have of the person with the developmental disability, then we need to start thinking about different kinds of emotional issues that might be going on for a person. We all have times where we might feel sad, we might feel loss or pain, or we might feel some anxiety, and that doesn't necessarily mean that we have a psychiatric disorder. It means there are emotional things going on in our lives, and we're giving the exact response we're supposed to, given our situation. So it's really important to understand with people with developmental disabilities, understanding things like, has there been a loss? Have they stopped being friends with someone that they really enjoyed being with? Has someone died or moved away? Has there been a pet that's ill or that isn't part of their life anymore? Is there bullying going on? Are people being teased? Is the person afraid to go to the place they usually spend their time because someone is not being nice to them? All those kinds of things are things we need to think about, because unfortunately, stress and loss and trauma are really common for people with developmental disabilities, and they don't always have the skills to cope with those things. Once we've understood the impact of emotional issues, the issues of supports and expectations, as well as really screening and taking care of medical or physical health issues, then we can start to figure out if there's a psychiatric disorder going on and how to treat it. Okay? But again, this takes time, and it takes input from more than just one person. So it's more than just one interview of somebody sitting down with a psychologist or a doctor or a therapist talking about their situation. It might include the person with the disability, the parents, the teacher, the staff person. And it might say, looking at on this day, which is a good day, looking on this day, which is not such a good day. Okay? It also includes looking at information that's been written previously. So if you're going to have this kind of assessment, this kind of understanding of the problem, we want it to be as rich as possible. So if there's already information that exists that would help understand the situation, bring that stuff in. It can be requested from one clinician to another clinician, but that can take time. So you can keep those things in a binder yourself and bring that to your appointments. make sure you share that information. There might be something really important in there that gives the history, the story of that person's situation, not just what's going on now, but what was happening before.